Well, it's open enrollment season, the time to choose a health insurance plan. And you might go the route, if it ain't broke, don't fix it, and stick with your previous plan, or you might look at whether there's another plan available that better fits your needs. Dr. Freda Lewis-Hall is Pfizer's Chief Medical Officer. Good morning, Doctor.
Good morning.
Let's get the foundation here first. What is open enrollment?
Oh, open enrollment is that time of year where many Americans have the opportunity to choose or change their health insurance coverage. And that includes their health care, including prescription medicines.
Yeah, I'm thinking about people who may consider this switch, but what if if you're happy with last year's coverage, why spend time looking at other plans out there?
You know, we get asked that question all the time, and here's why it's important to consider even if you're comfortable with last year's plan. Because plans may change year to year, and your health care needs may change year to year. So we suggest that people start with their health care needs. What kinds of doctor visits do you have? What kinds of care do you receive? What are the prescription medicines that you are on? And then to think, what might be happening over the next year? Is this the year that it looks like I'm going to have that hip replacement? Have I just been diagnosed with a chronic illness and will need new medications or new treatments? These things, write them down, and then you have what your health care needs are, and you'll have a chance to match it to a plan that's right for you or the best fit for you.
Yeah, Doctor, I want to take a second to talk about a formulary. What is a formulary, and why is it important to be aware of what's covered in that?
So a formulary is basically a fancy name for the list of medications that are covered by your plan. It's important to know whether or not the medications you're on or the ones that you might be on according to the discussions that you and your doctor have been having. Because medications that are on your plan's formulary generally have a copay, so when you go to pick up your prescription at the pharmacy, that is lower. If your medication is not on the formulary, you may end up paying much more for your prescription, all the way up to the full price of that medication.
Yeah,
now, many people don't know what's on the formulary.
Yeah.
So there's a chance to find out. Many plans have that information on their websites. If not, call the plan with the list of your prescription medicines and ask which ones are on and which ones are not.
Yeah, but like you said, our health needs change. So what happens if you're prescribed a new medication after the start of enrollment that isn't covered or maybe has a high copay?
Many people don't know that there's an appeals or petition process that's available to them by their health plan. So if you and your doctor decide that a treatment, including medication, is the right one for you or the best one for you, there's an appeals process that you can go through with your health plan. You can go on the website to find out what's required to do that, or you can give them a call, ask what information they need to have about this and or what forms need to be filled out.
Yeah, Doctor, you're with Pfizer. Does Pfizer support, do they have any support if patients have trouble paying for some of these medicines?
We do. We understand what a challenge it is to be ill and to need your medication and to sometimes not be able to afford it. So we have programs for people who meet an eligibility criteria up to 4 times the federal poverty level. And they would be eligible or may be eligible to receive up to 40 of our medicines, 40 brands of our medicines for free. But if you're not eligible for that, don't stop there. We may still be able to help you. We have substantial discounts for patients who are uninsured, copay help for patients who are insured, and last but not least, in some cases, we're able to help counsel patients on the plans that they may want to be a part of or could be a part of in order to make sure that they get Pfizer medicines or their particular Pfizer medicine.
Yeah, where would you direct our viewers to a website for more information about that?
We have a website, gethealthystayhealthy.com. And this website has lots of information and also has linkages to other sites that might be helpful during this time when there's so many options and so many decisions to make.
Yeah, Doctor, a lot of options, like you said, out there, a lot of choices. Thanks for your time this morning.
Thank you.